I remember fairly clearly actually back in high school doing biology classes, which was by far my favourite and best subject in school, and being told by my teacher during a dissection course that I should be a doctor. In fact, he told me I think that I should be a surgeon, and I decided, that was in year 9, I decided that day that I was going to be a surgeon. And then once I got to uni and started working and seeing what it was actually involved, I sort of decided that I really enjoyed orthopaedics, the very mechanical, concrete side of it, and then that just got reinforced the further I went through it. Seeing how much you help patients. I've always been interested in joint replacement surgery and trauma, and particularly in the more challenging joint replacements, so the ones, the hip and knee replacements in patients who've had childhood diseases that have caused them to have abnormal anatomy, or people who've previously had a hip or a knee replacement who, over the last, they may have had it a long time ago and it's worn out and failed, and they're much more challenging to reconstruct and redo. And it's not the sort of thing that you do without a bit of extra experience, and I don't think it's in the patient's best interest to be going and doing that kind of surgery if you haven't done extra training specifically in that. And so going and being able to spend the time working with people who are doing a lot of that kind of thing in very specialist centres overseas, especially when I was in Canada, I was doing revision hip and knee replacements. I think in the 12 months I was there, I did well over 150, so you get that very hands-on experience and much more experience, almost a career's worth of experience of that kind of difficult work in a relatively compacted period of time. I learned a lot more about the more difficult hip and knee replacements and revision and redo hip and knee replacements, especially while I was in Canada and England. And in England had the opportunity to work in Exeter at probably the most prestigious hip replacement centre in the world, where they designed the Exeter hip, and worked with some amazing researchers and cutting-edge surgeons in those areas. People come in who've been in pain for years with a hip or a knee issue, and they get a hip or a knee replacement, and you see them 6 weeks later and they're pain-free and happy and extremely grateful, and I find that very rewarding. One, being able to make that difference, but seeing how happy it makes the people that the patients that you work with. A young woman who's 21 years old who was involved in a car accident and had a fracture of her hip which was fixed, but then she also went on to get what we call post-traumatic arthritis from that. And when I first met her, again, she couldn't walk. She was on crutches, had been for 6 months because she didn't think there was anything that could be done, and was in constant pain day and night. And I did a hip replacement for her, and she's now pain-free and back working, having a normal life that she's now 23, that a 23-year-old girl should be able to have. And that being able to help people like that is extraordinarily satisfying.